This tutorial will provide an overview of the electronic claim submission to provide you with the information to promote the service with the providers in your area. There are a number of acronyms and abbreviations that may be unfamiliar to you. A glossary can be accessed from the Contents menu. Otherwise, the tutorial will cover the following areas: an introduction to electronic data interchange, what is needed to use ECS, the role of clearinghouses, a summary of key benefits, and how to handle some common questions and objections. The final section provides all you need to know about the National Provider Identifier. At various stages, there are checkpoints to test your knowledge. You can use the Contents menu to move back and forth to revisit a particular topic. A recent study by the National Dental EDI Council, or INDEDIC for short, illustrated how EDI claims have increased over recent years. However, the adoption rate appears to remain less than 50% industry-wide. EDI refers to the transfer of data from one computer to another. Providers enter claim data through their practice management system or via a web form on the payer's website. Upon submission, this information is passed to a clearinghouse, where it is verified and translated into a standard EDI format before being sent to the payer. Once received by the payer, the claim can typically be processed with no manual intervention, normally within 2 days. The INDEDIC website is a good source of further information and tips for using EDI. Most personal computers sold today have the memory and processing speed to manage a dental office and send electronic claims using a practice management system, or PMS. The requirements for size and speed of the computer will depend on the features of the PMS, other software programs in use, and the number of users. PMS vendors can provide recommendations for the dentist's office. A dental office will need to use the Internet for electronic claim submissions, and a broadband or DSL connection is preferred for faster service. A search engine such as Google can find local Internet service providers, or ISPs, that can provide details of the cost and availability of service for the practice's telephone area code. Otherwise, check www.thelist.com or ask other dental offices about the ISP they use. It may be possible to get a discounted ISP offer through a PMS vendor. A practice management system, or PMS, is the software used to manage dental offices and send electronic claims. The ADA Dental Products Technology Survey indicates that 90% of dental offices use computers, and 75% of dental offices use practice management systems. All PMS have the ability to generate claim output, both electronically and on paper. Most PMS vendors will help the dentist with integration services needed to create electronic claims from the dentist's system. PMS vendors can advise you of the cost, if any, for electronic claims integration. Basic single-office systems for managing appointments, claims, accounting, and statements can be found for $500 or less. Service and training may add to the cost. Multi-user and full-featured systems that include electronic charting and digital X-rays can cost significantly more. The ADA website includes a review of PMS products. However, asking other dentists about their systems can be a great source of information as well. If you do not want to purchase and install a PMS, some vendors, such as application service providers, offer a PMS on their computer system at no additional cost or for a small monthly fee with no long-term commitment or contract. The application service provider, or ASP, hosts and maintains the dental practice data. Using the Internet, the dental office registers with the ASP and uses the practice management software of the ASP to manage the office and submit claims. Another option is to send your claims directly to the payer. No practice management system is required. As an example, dentists can access the Internet to use web claim submission via www.deltadentalins.com to submit Delta Dental claims. An office can also check eligibility and benefits for their patients from this link on the Delta Dental website. Currently within the enterprise, digital attachments can be accepted by Delta Dental of California, Delta Care USA, and the TRICARE Retiree Dental Program, or TRDP. We anticipate this will be available for Delta Dental of Pennsylvania, Delta Dental Insurance Company, and AARP in the near future. Many other Delta Dental member companies now accept digital attachments as well. However, only 6% of all claims require attachments, such as dental x-rays. The most efficient way to send attachments is by using digitized attachments if the office performs procedures that require x-rays or other documentation for payment. The digitized images can serve as duplicate x-rays to mail to insurers or when referring patients to a specialist. In addition, claims will be processed more quickly with digitized attachments. Dental offices can send digital x-rays or other digitized attachments, such as periodontal charts, electronically to Delta Dental through National Electronic Attachment Inc.'s Fast Attach process. Any document, including x-rays, can be digitized by using scanners, which will cost $500 or less, depending on the size of transparencies that the dentist is most likely to use. A dental office should contact NEA or a reputable computer vendor to discuss equipment requirements for scanners and digital attachments. By using ECS, a dental practice can receive payments in days rather than weeks. Because the clearinghouse verifies the data required, most claims are not touched by a human, thus reducing the chance of errors. Clearinghouse checking also reduces the time involved in returning claims for missing information or errors, such as enrollee IDs and CDT codes. Electronic attachments such as x-rays, periodontal charting, narrative reports, and photographs will be accepted by most insurance companies. Electronic eligibility checks are fast and eliminate the need to call Delta Dental, thereby reducing the time taken to verify a patient's current status. This will result in an increase in dental office staff efficiency and productivity. Dentists can track the location and status of their claims and feel confident that they have been received securely by Delta Dental. A report is generated by the provider's software program prior to submission. However, this is not a confirmation report. Rather, it is to advise the provider as to what data will be transmitted. Immediately after the claim has been received by the clearinghouse, a transmission summary is returned to the provider. Again, this is not a claim confirmation, but verification of the details that have been sent to the payer from the clearinghouse. Finally, a claim status report will be generated by the payer as notification that the electronic claim has been received. At the Delta Dental website, www.deltadentalins.com, you can obtain an estimate of how much ECS could save a dental office. To determine the cost savings, input the provider's average patient volume and number of claims generated, along with the relevant staffing costs for processing the claims. The calculator will display the annual claims volume and costs per claim. Then compare the average total costs for paper claims as compared to that of electronic claims. Using these conservative estimates as an example, the dental office would save approximately $5,700 per year. Don't forget there are additional savings for faster payments, fewer rejections, and no-loss claims. In this section, we will look at some common reasons why providers do not wish to send claims electronically and provide you with the information to build your case for ECS. Try and use the information you've learned to think of a response before revealing the proposed answers. The hidden costs involved in submitting paper claims can be surprising. When you consider the combined costs of printing and mailing claims forms and savings in time and staff efficiency, it has been estimated that an electronic claim can save $3 to $5. Be sure to remind the provider to be aggressive and shop for the best price with vendors. This section will discuss the purpose of and requirements for the National Provider Identifier, or NPI. What is the NPI? Why is it required? Why is it important? How does a dentist get an NPI? What does the office do once the dentist receives the NPI? The administrative simplification provisions of the Health Insurance Portability and Accountability Act of 1996, or HIPAA, require the Department of Health and Human Services, HHS, to establish a national standard to identify providers. The NPI has become the established identifier for these purposes. The NPI is intended to replace the current provider identification information required by payers for claim submission. Federal law requires healthcare providers to obtain an NPI if the practice conducts electronic transactions such as electronic claim submission, verification of eligibility and benefits information over the Internet, checking claim status via the Internet. If the practice does not conduct any electronic transactions governed by HIPAA, there is no requirement to obtain an NPI. The original date for NPI compliance was May 23, 2007. However, this has been extended to May 23, 2008. One number will identify the dentist when submitting claims to multiple health plans, including Medicare and Medicaid plans. Electronic claims will function more efficiently. The NPI contains no vital information about the provider's name, location, specialty, patients, or qualifications. The NPI replaces the Social Insurance Number, Individual Tax ID Number, and other identifiers on standard electronic healthcare transactions. However, the NPI does not replace the DEA number on prescriptions, does not replace state-issued licenses and certifications, does not replace the Social Security number or the Individual Tax ID. Also, obtaining an NPI does not require the provider to submit electronic transactions. Dentists can apply for an NPI in three ways, completing an application online at https://nppes.cms.hhs.gov, completing a paper application, which is available from the National Plan and Provider Enumeration System, NPPES, or another organization may submit an electronic file on the dentist's behalf. Note, the last option requires very specific delegation and is not recommended for most dental practices. The dentist will receive a confirmation document from the NPPES, a copy of which should be faxed or mailed to Delta Dental's Dentist Network Administration and Contracting Department. The National Plan and Provider Enumeration System can provide help regarding the online application process. Any changes to an NPI, such as name or address, must be submitted to the NPPES within 30 days of changes. Further help and information can be found at the websites referenced on this slide: NPPES, ADA, CMS, HIPAA,